The time I know my status, I lose friends and my families. I'm not friendly the way I was. They're scared to be positive for me to get HIV/AIDS.
As of today, the number of patients that we enrolled from the time we started is about 982. And we only enroll children who are confirmed to be HIV positive. But as time went, I can tell you that the number started reducing. So I see that from the time the program was started, at least things are moving well, because even now we have seen few numbers of patients who are being enrolled in the clinic. So there is a reduction.
If the mother is on ART, if the mother is taking ARVs, as I said earlier, the viral load will be significantly reduced to almost undetectable levels. So because of this, the chances of transmitting the virus to the baby will be very much reduced to almost 0% levels. When they are still pregnant, when they come, they are mandatorily tested for HIV. Okay? So first contact, they come for antenatal, we test them for HIV. So the idea there is to help those who are going to test positive, so that we find interventions for them. And those who are found negative, we also encourage them to maintain the status, but we usually retest them every after 3 months. If you miss during pregnancy and during delivery, you may still intervene during breastfeeding. So you can still encourage the mother to start ARVs during breastfeeding, and by so doing, you are going to reduce the chances of the baby acquiring the infection. Apart from starting the mother on ART, of course there are other measures. During delivery, you may still reduce the chances of transmission if you opt for other options of delivery, like cesarean section. During breastfeeding as well, a mother may opt not to breastfeed, okay? Especially if they have the means. They may opt not to breastfeed and give formula feeds.
Where drugs are concerned, there is a difference between drugs for children and adults. If we talk of a child who is maybe less than a year, 6 months, they can't take tablets. So we have syrup. And now, giving syrup, a mother who is not educated, or an old lady, a grandmother, they have a very big problem in measuring drugs. The second thing is, with children, as they grow, the dosage increases. It is also an issue, like in our community. The child is taking maybe, for instance, we say half tablet in the morning and half tablet in the evening, and the other one in the morning, one in the evening. The moment you change, maybe that person didn't get correct that you have changed, that you start giving a child, instead of half in the morning, you give one in the morning and the half in the evening. They don't get that information. They'll be giving one in the morning, one in the evening. It becomes an issue, it becomes overdose to the child. So with children, it's really challenging for them to adhere well to treatment. The other challenge is this, the distance issue. To tell you the truth, if you happen to travel around people who come and you have drugs from Macha hospital, they come from a very, very, very wrong, and they travel long distances. So at least there is an achievement with the help of the hospital staff and the parents. When we work together, at least it's much better. That's why nowadays we always tell them that we don't expect to see a child who is born with HIV. So we would like encourage parents or caregiver to disclose to their children once they start asking questions. Not just anyhow that you feel like, no, the child is grown, maybe, because there are some who grow very fast. And then when you look at the age, you say, no, you are old enough, you must know this and that. So that's not the case. We encourage them to first of all see how that child maybe when the child start asking those questions, then they start bit by bit, maybe start with a different disease. Do you know about this disease, that disease? So that at least the child understands maybe 2, 3, 4 types of diseases. And then you try to also tell the child that, no, these diseases, this one is curable, this one is not curable. So that by the time you disclose that you have HIV, this HIV requires you to take these drugs for the rest of your life, the child will be in a position to understand. But there are some caregivers, mothers, whatever, who doesn't feel like their children shouldn't know. And then we have had a lot of challenges. Once the child reaches an age of about 14, 15, if the child is not informed about what the disease is, we have seen it and we have had a lot of problems. They tend to stop taking drugs.
I was sick. I went to the hospital. That's when they discovered that I'm positive. Me, I'm 28 years old. 22, 35.
Twagalibanji mumuyimba ngotuimba kolanga tata bamwiba gwesubagaloba kolanga tata igulila ngotulila iswe oleza tata wola ututole twagalibanji mumuyimba ngotuimba sobo kolanga tata bamwiba gwesubaga wagaindi kolanga tata igulila ngotulila iswe oleza tata wola ututole wola tata ututole umuzi wose swebo tugaimbe tugakomanya bakwesuba uniga ya mapenzi wola tata.
Our role, in short, is we try to get the pregnant HIV-positive mothers. We try to counsel them much more on adherence, because if they adhere to medicine, then the chances of them transmitting the virus to their unborn or to the child, it becomes very, very low. And sometimes it becomes to none, because if they are adherent to medication and they are following all the rules and they are healthy, transmitting to another person, it's most difficult. It's not unlike if they are not on medication. It's very easy for them to transmit the virus. So our role, simply we try not to make them worry so much. That's why we have these support meetings, so they don't feel that they are the only one taking the medication, but they come to be with the other friends. The project, of course, works closely with the clinic, because we are not doing any treatment, we are not giving medication ourselves, but we are doing much more of advocacy, education and testing. Then we link the clients to the clinic. So the goal of the project is to bridge the gap between the mothers who are pregnant and they're HIV positive, so that we can diagnose them as early as possible and link them to treatment.
Were you hearing about
I
HIV?
was just hearing, but I wasn't knowing that HIV being positive, it's carried somebody advice. I was just learning at school. There is HIV and AIDS like that. But I wasn't knowing that HIV, people with HIV live like this and this, about some medicine. That was, I wasn't with an idea.
Okay.
But I was just knowing that there is AIDS. But I don't know how it comes, the results like that.
The adherence is talking to the mothers. They listen if you talk to them. If you explain things, you know, sometimes it's very difficult to explain the jargons of medicine. So you try to stream it to their level, but try to interpret it to relate it to something that they can understand. Even how the system works, even how the medication works in their body. So you try to find ways and means to make them understand at their level. So that's how we manage to keep even the adherence to go high, because once they understand, then they will never skip the medication. They will know, okay, this is what is helping me.
Mabwera kwandi ne one ku kwankala combine meeting ya bonse na ijane mabwera kuleta mababies ngo tuponzisira mu wasongira abana
Mabwera.
Papa yakatatu na support meeting team mabwera.
Orange babies, it's good.
Orange babies, they do good thing.
It's a very good. Go watch the good.
That time, most of the friends died because there was no medication, leaving the children, and the children were being born with HIV. So I started taking in my house 2 children who were very sick. And then we also started working with some doctors, treating them, where I used to get my medication. And then the number started growing. That's how I started, living with children who were HIV positive. And up to today, now these children have grown, they are big. Yeah. Orange Babies came to our aid in 2006. They started supporting us in 2006.
When you're on treatment, when the viral disease suppression, the viral load is low and detectable, you're as good as a person who has more virus. That's how, when it reaches to that, you just like anyone else. But does not mean you're HIV free. The virus will still be there.